So you were expecting a baby boy, or you just had a newborn baby boy, but no one gave you a list of some of the things, both surprising, normal, even abnormal things that may happen with your baby. In today's video, we're going to be talking about 10 things that a newborn baby might do, or some abnormal things to expect, and when to seek care. I am Dr. Nkirika. I'm a pediatrician and pediatric care doctor, and I'm also a mom of 3. When I had my first child, who was a son, I was not ready for some of the interesting and shocking things I was about to learn. Number 1, your baby boy may have intermittent erections of the penis. This is nothing sexually related, and it typically does not stay erect for a long time. These erections commonly happen when you take out the diaper, but it may also happen when they are cold and during shower. It could also happen when they wake up from sleep and they're stretching after a long sleep. But most importantly, it may mean they're about to pee on you, so you need to be careful, or you may get showered with their pee. And this ushers us into number 2. Your baby boy will pee on you almost all the time. Baby boys don't know how to aim down yet once the diaper is open, so they're more likely to pee up to you every time you try to change the diaper. I learned this with 2 of mine, and even as a pediatrician examining babies, I've been sprayed a few times. One trick is to always have a wipe ready when you're ready to change them, so just in case they start to pee, you can put the wipe directly on top of their penis. Or you can open the diaper gently but not fully, and you can cover it back when you notice they're already peeing. And also, because baby boys are more likely to pee up, it's also one of the reasons why we always recommend tucking the diaper below the umbilical stump. Because they don't know how to pee down, they're more likely to pee up and aim towards the umbilical stump, and that may get urine all over it and have a high chance of getting infected. Number 3, your baby's testicle may or may not be in the sac by the time they are born. This is basically what we call undescended testicle, and if your baby is premature, they have a high chance of having an undescended testicle compared to a full-term baby. Naturally, baby boys should have 2 testicles, which most people know as balls, and they should sit in the scrotum at some point in their life. During the whole process of birth and the organs forming, these testicles actually come in all the way from the abdomen, the belly, and they gradually make it all the way down through the path and end up in the scrotum. But for some babies, these testicles may not make it all the way down into the sac by the time they're born. So we say they are not descended and call them undescended testicle. This is very common and typically nothing to worry about within the first few months of life, because a lot of them, more than 90%, actually descend within the first 6 months of life. But if your baby's testicle or testicles are not descended by the time they're 6 months old, your doctor, you should ask them to send you to a urologist, because they need an evaluation and a decision to be made to bring them down. To know if your child's testicle is undescended or not, you as a parent can actually feel. You're likely to feel 2 balls on each side of the scrotum. If you're not feeling these balls, you can have your regular doctor check just to make sure everything is fine. So again, for baby boys, undescended testicles are normal and are common until 6 months of age. After 6 months, you need to see a urologist to decide on surgical intervention. Number 4, your baby boy may develop enlarged breasts and may even leak milk. Now, this is more common in girls, but can also happen in boys. It typically happens because some of the hormones is getting weaned off from pregnancy and from the parent. Their breasts might look swollen and large and may even leak milk, which parents used to call witch's milk. This can be scary and may even look embarrassing for the parents, and there's always the urge to squeeze it and massage to help it go away, but please don't, because that actually makes it worse. The act of massaging and squeezing actually can make it look larger, but can also introduce some bacteria which can make it get infected and look red and become more painful for your baby. These enlarged breasts and even the making milk are typically not painful, and when you leave them alone, they typically resolve on its own between 2 to 4 months of age. But if it's not resolved, you want to talk to your regular doctor and see if your baby needs more evaluation. Number 5 is a hydrocele, which is a fancy name for when there's a fluid collection and the pouch that holds the testicle and the scrotum. It is actually very common in babies, and of course in 1 to 10 baby boys, but it still remains one of the scary things that I see families in the emergency department for. It typically happens from birth and pregnancy, from all the fluid collection and the shift and all the changes that happens during pregnancy and through delivery. It can happen on one side, one scrotum, or can happen in both, and you typically see it as your baby's genitals, especially the scrotum area, looking swollen and big. And because it's filled with water, when you shine light through it, you notice it transilluminates and looks a little bit glossy. With hydroceles, you will also notice it tends to become smaller and shrink when they lay down at night to sleep and throughout the night, but also gets bigger during the mornings and with activity. Hydroceles in babies usually different from the ones in adults, and they're benign and mild and usually resolve on its own between 12 to 15 months of age. It's nothing you need to squeeze or drain the fluid from, but if it's not resolving by the time they're 15 months old, your doctor can send you to a urologist for an evaluation. And the reason we actually recommend an evaluation at that time is even though they're benign, there's also an increased risk of testicular torsion or even leading to a hernia. Number 6, your baby boy may have a hernia. Just like adults, babies may also have hernias, but the cause is also completely different. I will get into the details of the causes are, but for babies, it's more from a defect that has not completely closed and is more likely to close as they actually get older. For babies that have a hernia, you will notice a bulge on the side of the groin that gets bigger when they are crying, coughing, or when they're bearing down. And this bulge usually also reduces on its own after they're done coughing or crying. In most cases, this bulge getting bigger, reducing on its own does not bother your baby, but they actually need an evaluation by the surgeon to discuss closing the hernia. In some scenarios, which we consider an emergency, some intestines may get stuck inside the hernia and not become reducible anymore. And this may cause pain, swelling, being tight, and obstruction for your baby. And that's an emergency. We actually need to see them in the ER for immediately. Number 7 is another emergency that I want every family to keep an eye on, and this is called testicular torsion. Testicular torsion is definitely not as common in babies, but I've seen a handful of babies lose their balls and testicles as a result of a torsion. It is more common in teens and adults, and most families don't know it can happen to babies, and for that case, they don't really know what to do or come in immediately when they notice this finding. Some babies are born with it, which means by the time they come out and being born, the testicle is already twisted and dead and just needs to be removed. Some other babies may have the testicular torsion within the first month or first few months of life, and you will notice your baby's testicle and scrotal area being big and swollen and red if they're light skin or darker if they're darker skin, and they will be extremely painful, so your baby will be inconsolably crying. This is one of the other reasons I always recommend and ask families to remember to check the genital area if your child is crying inconsolably, because the baby can have what we call testicular torsion. So again, testicular torsion is not common, but you want to look out for swelling, testicle scrotum that's hard, painful, red or dark based on your child's complexion. Number 8, your baby might have a strand of hair or sock looped around their penile shaft. Babies have tiny parts. Their fingers, their toes, their penises, they're all tiny. And during postpartum period, a lot of parents and moms shed a lot of hair, so they can have pool and strands of hair wrapped around their penis. And when this happens, you may not notice it immediately, and if your baby is actually darker skin, it may take a longer time to notice. It is also one of the reasons I always recommend families check your baby's parts every so often, and when they cry inconsolably, do not want to be held, their feet and they're still crying, you want to check their parts one by one just to make sure there's no strand of hair or sock that is looped around it. Number 9, your baby might have orange colored urine crystals, which you may notice as orange colored pee in their diaper. You may notice this within the first few days of birth. It is not blood. We actually call this urate crystal. This usually happens because babies are born with a high content of uric acid, which goes through the placenta, and because they also don't drink enough and pee enough, their urine may look a little bit concentrated and they pee those crystals, which appears as orange in the diaper. It should last between 1 to 3 days, and by the time your baby starts to drink more and feed better, this orange color crystal should start to disappear. If you are noticing this orange color pee and crystals persistent to about 1 week, it may be your baby might be a little bit dehydrated and something you need to talk to your regular doctor about. And finally, number 10 is hypospadias. This is not as common, but it is scary and can happen to some babies. Hypospadias is when the opening, which is the urethra, which your baby should pee from is not at the tip of the penis, and it is on the underside. It is something your doctor typically finds on examination after they are born, but if they don't, it is something you as a parent can also check for. Every baby's urethra should be at the tip of the penis and not on the underside. So if you're noticing your baby's on the underside, maybe your doctor didn't tell you. We also look for other abnormalities that may happen with or it may happen in isolation. If your baby has hypospadias, they should be sent to urologists because most of the time it needs surgical correction. And that's it for the 10 things that may happen to a newborn baby and when you should seek care for an intervention. Now let me know in the comments which ones your child did or which was a new learning fact for you today. In the next video, we'll be talking about newborn things for baby girls. So don't forget to turn your notification button on. Thank you for watching and I will see you in the next video.